Hi everybody, welcome to Healthline. I am Grigoryan. So it is summer. You are hopefully out and about. You are hiking, swimming, running, being as active as possible. You are also wearing your sunscreen. You are also drinking lots of water. You are taking care of yourself. You are getting lots of rest. And you decided to spend more time off the phone, off the iPad, off your TV. Our world is all about being on Zoom now. We're going back a little bit into face-to-face. Do you realize that if you put your phone down and look away for at least a minute to 2 minutes, you are giving your eyes the rest they need? Our mission here at Healthline, my mission for you, is to give you a lot of great antidotes and solutions to be as healthy as you possibly can. That also means standing up, stretching your feet, working out, doing jumping jacks, doing everything. And since we've spent the last 2 years inside wearing a mask, I'm inviting you to get up and go outside and still wear your mask when you need to, still wash your hands, still pay attention and listen and get your vaccines and do everything you need to be as healthy as possible. You got it? Great. So the conversation today is all about preventative medicine and what self-exams you need to do, what you need to pay attention, and the questions you need to ask. So I'm going to make it easy for you. I'm going to ask the questions and I'm going to give you the answers. Joining us again is one of my favorite doctors, Dr. Elizabeth Grigoryan from Adventist Health Glendale, and her practice is family medicine. Welcome back.
Thank you. Thank you for having me.
You kept your promise. You came back.
Yes, I did.
My aunt, Auntie Rima, look, I told you she would come back. How was my intro? Did you like all that I was saying?
Yes, perfect. I like the transition from hopefully post-COVID, but although we do have some cases still, but...
And we still have to pay attention.
Exactly.
And which means that's why you're here today, because you said before we started filming that you don't want people to come in and talk to you about signs and symptoms, meaning you're there for them, but you want your patients and everybody that's watching to really pay attention and live their life with preventative steps and measures.
Exactly. So a main part of family medicine is to prevent disease. You know, we do have patients that do come in, they have symptoms usually, and I will say it's mostly the men who have symptoms that come only.
Guys, do you hear that?
So, you know, it's important to prevent the disease so then we can actually do something about it when we can.
But it's also, I mean, we already have to get ready to wrap out, but there is so much conversation about what we personally can do that then turns into what our bubble, our world, our family and friends can do. So a lot of what we offer here is information just to keep everyone as healthy as possible.
Exactly.
More Dr. Grigoryan when we come back, and hey, as I invite you every time, have some water, do some jumping jacks, have an apple slice. We'll see you on the other side. Don't go away. Welcome back to Healthline. I am Grigoryan. Joining us is one of my favorites, Dr. Elizabeth Grigoryan. Her specialty is family medicine. Doctor, you said that most culprits are men.
Yes.
Why is that? Are we just too afraid to talk?
Well, I will say just culturally, our Armenian men, I do have a lot of Armenian patients, they are more, you know, they tough it out. They don't go see a physician until they have to, or until they have some symptoms that are bothering them more than other symptoms. So that's what I've seen usually.
Well, because you walk the walk and talk the talk.
Yes.
So doctor, why do you think men don't talk as much about signs and symptoms? Do you think it's more of an ego thing?
I do believe it's an ego thing. I think it's a sign of weakness in their mind that, you know, if they bring it up. And you mentioned sexual issues. Definitely,
Sure.
Erectile dysfunction is one of the common symptoms that, you know,
lead to cancer.
Exactly, lead to cancer. And also, it does urge men to come in to see a doctor, I will say.
Okay, okay, so here's the thing. We don't want you to go through any of that, men. But here's one thing that we invite everyone to do. If you are in a relationship and there's something that you know differently or you're feeling differently, have a conversation with your partner, with your wife, your spouse, your best half. You know what I'm saying?
Exactly.
And really make your health a conversation between you two.
Exactly.
Take off your clothes, look at each other, see if there's anything you see differently.
Yes.
That's being preventative. That's being proactive. That's the word, proactive in your health.
And I really like that you mentioned that, just examining skin. Skin cancer is very common, and just noticing.
Let's start with skin cancer.
Okay.
What being preventative with skin cancer, especially in the summer months, and
Yes.
wear your sunscreen. What do you recommend us to wear sunscreen wise?
I usually recommend SPF 15 and above at least.
15 and above.
At least 15 and above.
Okay.
30 is preferred. Usually after, if you do 10 times the SPF number, after 100% of protection, you don't really have too much. I know a lot of people go for the 50,
Sure.
60, but 30 I think would be a safe number. And then also, if you are in the sun, make sure that you're in the safe hours. Usually
Is it
that's
before 10?
yes, exactly.
And after
4.
4.
Mm-hmm.
Also, put sunscreen on your scalp.
Yeah, that's true too.
Okay, so sunscreen, reapply. And if you are looking for skin cancer or something, what is somebody looking for?
They're looking for changes in their current moles that they have,
Okay.
either the size, the color, the shape. So definitely those are some of the things that they would look. So if it's getting larger, if it's changing in color,
If it
it's getting
breaks, if
darker.
the skin breaks and bleeds.
Exactly, that's another.
Okay. Women and self-exams for breast cancer, we talk a lot about here on
Yeah.
the show, and I loved it because of shows like ours and the conversation. Self-detection is huge.
Exactly.
Talk to us about preventative solutions for women in breast cancer, also with men.
Okay, so for breast cancer, definitely it is one of the most common causes of cancer, breast cancer, but it's not the most deadly. So lung cancer would be the most deadly.
We're gonna spend time on that
Yeah.
because a lot of you know who we're talking to.
Yes. So with breast cancer, before we would recommend that women do self-breast examinations. If they feel pain, if they feel a lump, to then see their primary care doctor, where they would start the process. If they are younger than 40 or 45, we would start off with an ultrasound. But if they are in the higher risk age groups, then we would start with mammograms.
And when you say high, I'm sorry for interrupting, but when you say higher risk, that means if it's hereditary in your family.
Exactly.
If culturally, there's other cultures that are more predisposed to it.
Yes, and usually, over 50, it's more common, but there are different recommendations from different groups. The American Cancer Society recommends to start a discussion at age 40, but definitely start mammograms at 45.
When do you invite women to, and men to self-exam?
Yeah, so at age 40 for women, definitely for breast cancer, I do start a conversation saying, hey, do you have any family history? Would you like to get started on it? It's a personal choice. I'd like to have a shared decision making with patients. And then for men, testicular cancer is actually common in the younger group and also the very elderly group. So
when you say younger and older, what ages are we
so
looking
like
at?
18, 20, so they're 20s and then over 50s.
One thing I want to say too, as I've said a lot on the show, out of every new 100 diagnoses of breast cancer, up to 1 to 3 are men.
Yeah.
And when I say self-exam, hold your arm up, and for women as well, or to lay down just so the breast lays flat, and just check and see if there's anything that feels different or looks different.
Yes.
And if the nipple has a discharge, a color change, stuff like
Exactly.
that. And guys, the same thing with testicular cancer. Just check out your testicles, see if something feels different, if there's chronic pain, if there's sensation, or if there's a bump or something that just is different.
Exactly.
And you can do that on your own. You don't have to do it from the age of 40.
Yeah.
You can do it, you are the captain
Earlier.
of your ship, so just
Exactly.
check yourself. And also, don't you recommend for women to go in, we talk a lot about this in October, Breast Cancer Awareness Month, to find a group of women, find friends,
Yeah.
and go in and do a mammogram check.
Yeah.
And do it as a team in a group, because you go through it together.
Yeah, I think the accountability is important, just having somebody, it's like, hey, we're due for a mammogram. So,
And what do you say to somebody that's afraid?
you should be afraid of the possible consequences. I believe, it's better to prevent the disease than to have to deal with it after.
You're so good. More Dr. Grigoryan when we come back. Don't go away. Welcome back. If you haven't received your COVID-19 vaccination yet, slow the spread of this virus by getting vaccinated as soon as you can. Don't forget to wash your hands. The conversation about mask wearing, some say yay, some say nay. Here's the thing. If you feel like you have a cold or not feeling well, 1, stay home, 2, take care of yourself, and throw on a mask. I don't want your cold. It's all about conversation, and for so long we've been taking such good care of each other. Let's not change that. Joining us from Adventist Health Glendale is Dr. Elizabeth Grigoryan. Doctor, before we dive into more preventative medicine, share with us some of your medical background.
So my medical background, as I had mentioned in our previous talk.
I want to hear it again.
Yeah. So I did go to UCLA for undergrad. That was always my dream. Then I went to Ross University for medical school. I did my training here in Los Angeles, California Hospital Medical Center. And we also had an FQHC Eisner Health, where I did see a lot of underserved patients, and I do enjoy actually having a wide variety of patient populations.
And why family medicine? Why family practice?
I like everything, so I couldn't choose one. Yeah.
My favorite type of doctor.
Yes.
Doctor, let's dive back into preventative and women. Cervical cancer.
Yes. So cervical cancer, you know, it was a very common cause of death in women, but most recently it has gone, you know, almost disappeared just because of our preventative pap smears and yearly checkups. So usually the recommendation from the USPSTF, which is the US Preventative Service Task Force, they do recommend to start at age 21, but the American Society of Cancer or Cancer Society has increase the age to 25, to start at 25. So.
But if a woman wants to come into your office and say, hey, can we do a pap smear just because I want to make sure everything's okay, is that available?
Of course, but I do have a conversation. I, you know,
Love that.
inform them, educate them, saying, you know, it's not as common. Let's say if an 18-year-old who's sexually active comes in and wants a pap smear, I would make sure that I educate them that it wouldn't be something that we would be doing just because it's not a common it's not common in that age group.
But one thing too that you just said about a young lady that's sexually active, that's a huge preventative conversation that we know where we are in the world today, that being sexually active means you have to be accountable, be responsible, and know what you need to do and what not to do.
Exactly.
And one thing too for women is the word no means no. And stop means stop, and for you guys out there, it just means no.
Yeah.
And have a conversation with your doctor. If you're afraid, have a conversation with your parents.
Yeah.
And talk about STDs, because that's about being preventative.
Exactly.
You know, wearing a condom, taking care of yourself, and realizing that sometimes you are just too young to do certain things.
Yeah.
Women and ovarian cancer. First of all, in cervical cancer, are there any signs and symptoms that women should look for?
So, you know, just painful sexual intercourse would be one of them. Abnormal bleeding, spotting in between their menstrual cycle, just overall
abnormalities.
Abnormalities, yes.
If there's a one-off of an abnormality, could it just be, oh, this is a one-off, or does somebody need to call your doctor immediately and say, hey, there's a change in my cycle, let's talk?
So I mean, sometimes, you know, with stress and different eating habits or exercise even can make your menstruation differ from the norm. But, you know, if you should listen to your own body. I always recommend that because you know when something's wrong. Just don't avoid it.
Ovarian cancer, it's considered a silent killer for women. Is there anything that women can do to be preventative?
I think that family history is very important. So making sure that you know about your grandma, your mother, if they've had any history of ovarian cancer, and then if you're having issues with pelvic pain, it's not the first step, but definitely a pelvic ultrasound wouldn't hurt. It's not a recommendation as far as that, but if you are having symptoms, that is something that I would order just to make sure that we're not missing some kind of mass or ovarian cancer.
And isn't also one of the signs and symptoms excessive bloating that it just comes out of the blue.
Yes, that is when.
And weight loss, right?
Exactly. So fevers, chills, unintentional weight loss, night sweats, those are the cardinal symptoms of cancer.
So we talked about breast cancer, cervical cancer, ovarian cancer. Any other cancers for women that we can talk about for preventative health?
No, I think we're...
Okay, for men, signs and symptoms and preventative for prostate cancer.
So for prostate cancer, obviously any changes in your urination, if there's dribbling, if there's hesitation, if you feel, you constantly need to empty your bladder, but it's not fully emptying. It's a decision that you need to make with your doctor, because let's say you order the PSA test. After that, then are you okay with moving forward to do a biopsy, then
Sure.
the ultrasound? So all of those things. And once again, so smoking cigarettes, alcohol use or abuse, I would say, unhealthy weight, diet. So all of those things play a part in your risk factors that increase it. So if I do have somebody with those risk factors, I definitely am more aggressive in getting lab work done and imaging.
Also blood in your urine.
Yes, blood in your urine.
What is the age for men to go in to get a prostate exam?
Usually, I say 50 for preventative. If you don't have any symptoms and you do want to get started, and you do have those risk factors, 50 is my magic number.
And as we are getting ready to wrap out, one thing too is, gentlemen, most men are afraid of a prostate exam. They're not as manual as they used to be. However, I've done this before and I'll say it again, there is an exam that a doctor will do that possibly can save your life. It is 5 to 10 seconds that may be awkward and uncomfortable, and it will save your life. So let go of the ego and let's turn the conversation about men not going to the doctors around, because your friends and your family want you here a long time. Don't go away, more on the other side. Thanks. Welcome back to Healthline. The conversation is all about preventative medicine. Joining us from Adventist Health Glendale is Dr. Elizabeth Grigoryan. Doctor, during the break, you said that you really want to spend some more time on our lungs, smoking, alcohol, and I am a former smoker, 2 packs a day for 20 years.
Wow.
And I am very lucky and fortunate. I killed my last cigarette, and over 17 years later, I had a CAT scan. Everything is great, but you just said for former smokers have a CAT scan every year.
Yes.
Why is that?
So, you may not have it one time or that first year, but there are certain types of lung cancer that are quite aggressive.
Okay.
And you may have missed it, within that 2-year gap or 3-year gap, how many ever years that you don't get a repeat CT scan. So there's 3 criteria to getting a CT scan of your lungs. So one is being age 50 to 80 and having a 20-pack year smoking history. And 20-pack year means either you were smoking for 20 years 1 pack, or you could be smoking 10 years 2 packs. And then the third thing would be that you are a current smoker or have quit smoking within the 15 years.
Bottom line, smoking will kill you, can kill you.
Yes.
For everyone that is afraid to quit smoking, what do you say to them?
I always say, the stress or that relief that they get, it is not worth. I always make fun of my husband, I will say. He smokes, so I say, do you want to go to Disneyland with your kids with an oxygen tank carried around? So, it's just a lifestyle that later on you will feel it. You may not feel it now, but I think a lot of people don't foresee the complications of cigarette smoking.
I love that you said that. So just imagine yourself at Disneyland with an oxygen tank. My mother passed away from esophageal cancer, and it's a horrible death. So for you or someone you love that wants to quit smoking, reach out to Dr. Grigoryan. There are many, many organizations and places at Adventist Health Glendale that will help you stay stopped. And here's one thing that I'm going to throw at you. It's a choice. So you wake up, you light a cigarette. What about waking up and not having a cigarette? Your urges will diminish within a couple weeks, and when you have that urge, drink a glass of water,
Yeah.
because then the urge will disappear.
Yeah.
The world has been tough on everyone.
Yes.
Students in school, learning on Zoom and not as much engagement. Depression.
Mm-hmm.
Talk to us about depression and where we are today and what we need to do.
Yeah. So with depression, I do think it's something that's missed a lot of times. You know, I do have patients that come in and they just seem, you know, their mood is down, they're not their usual self. If they usually dress up, they look like, you know, they may not have made so much of an effort that day. So I usually do go into the questions of, you know, have you been sleeping less or more? Have you loss of appetite, loss of concentration? So there's a questionnaire that usually, you know, as primary care doctors, we do have available for patients. So, you know, it's called a PHQ-9, and based on that, then we have a conversation. Would you like to start therapy? How can I assist you or help you to, you know, make things better? And medications obviously are another option.
And one thing we also need to realize is that it's been tough on everyone.
Yeah.
And having a conversation and saying, hey, I'm scared.
Yeah.
And hey, I feel worthless. I feel like I don't have anything. I'm going through all these things. You're there to make sure that your patients or whoever know that they're not alone.
Yeah.
So be honest with your doctor. Talk to your doctor. Let's talk also about, you know, kids, especially this year, are on their computers and schooling and bullying. How do you feel that we can be preventative with bullying?
So bullying, you know, it is inevitable, unfortunately. I always say kids learn from home. So that's one thing that we should be mindful of. You know, if we do have tendencies to bully adults, and
Sure.
even adults bully, so kids learn what they see.
From mom and dad.
Yeah. And I always say, you know, if you do feel like your child's not going to school, or they're not wanting to go to school, or they seem like they're crying or making up excuses not to go to school, those are some of the signs that, you know, should trigger a parent to ask further, maybe go take a visit to the school, ask the counselors, because it is there. Instagram, Facebook, they put a picture and somebody may say something distasteful that, you know, would trigger a child to be more self-conscious, cause depression, and that depression then leads to
Self-harm.
addiction.
And also acting out.
Exactly. And addiction as well later on in adult life.
And here's the thing with addiction, alcohol, drugs, sex, gambling. Being on your phone is an addiction. If somebody is bullying you when you are online, turn off your phone, block them.
Yeah.
Talk to your parents. I guarantee you, you will not get in trouble if you say to your doctor or your parents, I am struggling, I am having trouble, I need help. Yeah. It's just about reaching out, don't you think?
Yes, definitely. Those are great tips.
Preventative health and wellness.
Yeah.
What can we do, men and women, kids, to be healthier?
So main things that I always recommend: be active, as you always mention, physical activity, healthy eating, you know, make sure the sun exposure, as we mentioned earlier, avoid tobacco use. I know even e-cigarettes and all the vapes and all that, they're no good. Limit alcohol usage. Should be 1 cup for a female, or like 1 shot glass, I would say, and 2 for men.
Sure.
Limited to that. And then just, you know, healthy weight. So all of those things, and be cognizant of your family history, because, you know, things tend to repeat itself. So.
And also have conversations.
Yes.
You know, we could talk for hours. You know, the opioid epidemic is huge.
Mm-hmm.
It's just having conversations. One conversation will make a change. And one thing I want to say too about bullying is, if you, since everyone's back in school now, if you see somebody by themselves or on their own or feeling like they're not included, go up and say hello. Yeah. We all want to feel like we matter. Exactly. I love having you here. Will you come back?
Of course.
Promise?
Yes, as promised.
Okay, so this is number 2. So Auntie Rima, Dr. Grigoryan is coming back. So our mission here is to make you as healthy as possible, to give you solutions and antidotes and things to take on yourself, but also pass on to your family and friends. Remember, the most important conversation you're going to have is about you and your health, so why not start talking today? You can find us on social media. You can find us on YouTube at Adventist Health Glendale, and you can also follow us on Facebook at AH Glendale, and I am at Gregory Zarian. Take care, be well, and we'll see you next time.